There is an unsolved medical mystery festering in the history of modern medicine. A medical research ethics scandal buried under layers of official reports and closed-door settlements. This is not a ghost story. It is worse. It is the true account of a medical trial cover-up that consumed an 18-year-old boy. This story is a living nightmare. What you are about to hear is a descent into a true medical horror. For the full effect, I suggest you put on your headphones now. Let the darkness in. His name was Jesse Gelsinger. He was 18 years old. He believed in a future. He believed his life could matter. He carried a silent monster inside him, a genetic disorder called OTC deficiency. It meant his body could not process ammonia. For most infants, it is a death sentence, a slow poisoning from within. But Jesse had fought the monster to a standstill. He managed it. He lived a life. He had dreams. Then they offered him a chance to be a hero. It was a poison apple dressed as a golden opportunity. Researchers from the University of Pennsylvania presented a groundbreaking gene therapy trial. It was a chance to slay the monster for others, a chance to make his suffering mean something. Jesse saw a purpose. He saw a legacy. He never saw the trap. His consent was given in light. Their intentions were shrouded in shadow. The therapy was a Trojan horse, a modified adenovirus, a common cold virus engineered to be a delivery system, a perfect little key for a biological lock. But the key was broken. It was a thing of ruin. The animal trials whispered the truth. The truth was screened in silent laboratories. Monkeys injected with this vector died. Mice subjected to its touch succumbed. Their immune systems did not fight the invader. They detonated. A catastrophic inflammatory cascade. A biological firestorm that burned them from the inside out. The dose that killed them was terrifyingly close to the dose prepared for Jesse Gelsinger. This knowledge was sealed away. It was hidden from the boy and his father. It was the first secret. It would not be the last. Jesse's own body was a compromised fortress. His liver was weak. His ammonia levels were a warning flare in his blood. The trial's own protocol should have barred him. He was a terrible candidate. He was a walking risk. They enrolled him anyway. Perhaps his mild condition made for a better story. Perhaps they needed a face for their success. They needed a healthy-looking boy to prove their science was sound. They chose Jesse. They signed his death warrant with a permission form. The morning of September 13th, 1999 arrived. A needle pierced Jesse's skin. The viral vector entered his bloodstream. 3.8 trillion viral particles swam into the dark. For a few hours, there was only a fever, a false calm. Then the clock began to tick. His immune system sounded the alarm. It recognized the pathogen. It saw the invasion for what it was, and it launched its entire arsenal. This was not a fight. This was a self-immolation. His body was turning on itself. Within 24 hours, Jesse Gelsinger began to unravel. His fever became an inferno. His lungs filled with fluid. Doctors forced a tube down his throat. Machines breathed for him. They sedated him. They restrained him. They watched as the cascade took hold. His liver, the very organ they sought to fix, began to necrotize. Jaundice painted his skin a sickly yellow. His blood lost its ability to clot. He began to bleed internally, a slow hemorrhage into his own tissues. By day 3, the machine was all that was left. His kidneys shut down. His heart faltered. The poison in his blood crossed into his brain. Cerebral edema. His brain began to swell against the unyielding prison of his own skull. His father, Paul, could only watch. He watched as the son he raised was systematically dismantled. The machines hummed and hissed. They were a chorus for a dying god. On September 17, 1999, Jesse Gelsinger was declared brain dead. The life support was switched off. The silence that remained was absolute. The autopsy was a confession. Pathologists found the virus everywhere. It had replicated beyond all expectation. It had colonized his liver. It swam in his blood. His organs showed the unmistakable signature of an immune system gone berserk. It was the same pattern. The same horrific pattern seen in the dead lab animals. The science had predicted this. The data had foreseen this exact catastrophe. They had injected him with a known poison. The subsequent investigation peeled back the layers of this medical trial cover-up. The informed consent forms were lies of omission. They never mentioned the dead animals. They never disclosed the severe reactions in previous patients. They hid Jesse's own ineligibility. Financial conflicts of interest were uncovered. The lead researcher held stakes in the company funding the work. Careers were on the line. Glory was on the horizon. Jesse Gelsinger was just a stepping stone. He was collateral damage in the pursuit of progress. The reckoning was bureaucratic. Trials were halted. Fines were paid. The University of Pennsylvania settled with the family. The researcher stepped down, but none of it mattered. It was all sound and fury, signifying nothing. It did not bring back the boy. The cruelest irony is that gene therapy eventually worked. It became a real treatment. It saves lives today. Jesse Gelsinger did not contribute to that success. He was its sacrifice. His death was the lesson the scientific community needed to learn. He was 18. He wanted to matter. He became a warning. They say the road to hell is paved with good intentions. I believe it is paved with consent forms and hidden data. Jesse Gelsinger is not resting in peace. His story is a ghost that haunts every research lab, a whisper in the sterile silence, a question that can never be answered. Did he die for science? Or was he murdered by its ambition? Follow this channel if you dare to uncover more stories they tried to bury. The truth is a patient thing. It waits in the dark for someone to listen.